This past year found our society faced with unprecedented challenges due to COVID-19. Those in the healthcare profession have been asked to put their own lives at risk to save others. They have also been tasked with determining equitable and just protocols for allocating scarce resources, ensuring that necessary and rapid human subject experimentation was performed ethically and with the full consent of those involved. And now they are charged with finding a way to distribute the resulting vaccines to the most vulnerable among us. A distinction must be made between the so-called medical crisis manufactured by the Nazis and the very real medical crisis caused by COVID-19. However, the lessons of the Holocaust, how the power and privilege of medicine can be influenced by external factors so as to place the care of the individual in a secondary role, have informed our current situation as we have struggled to meet this challenge in the most ethical manner possible. What can the Holocaust teach us about the ethics of care during a pandemic? And how can these lessons be incorporated into the development and distribution of the COVID-19 vaccine? The next part of our program explores these questions.
The Holocaust is still very relevant today to medical ethics. And not simply in terms of the Holocaust was the starting event or the originator for contemporary medical ethics today. What the Holocaust can teach us is that medical ethics is not simply a matter of doing well and doing good in easy times, but recognizing that the skills that a person develops in their normal course of daily practice are skills to develop and to strengthen so that when a person's environment gets more challenging, when the stakes are higher, when there is more risk to more people, such as in a pandemic, we don't throw our ethics out the window or exchange the ethics and the professionality that we've been developing in quote-unquote normal times for a quote-unquote pandemic or crisis-oriented ethics. The Holocaust can teach us that if we practice what we aspire, and if we maintain the values that we continually preach, then we will be able to use those techniques, we will be able to uphold those values even in a time of crisis, even in a time of pandemic. I would like to say that what the Holocaust can inform us is, even today, that if we don't make sure that ethics is seen as a skill to develop rather than content to know, then we won't have those skills when we need them. We need to recognize that at any time, but especially at a time of pandemic, when the risk to human life is so great, that we're not simply playing a numbers game. We don't want to make sure that we protect the group at the expense of the people that may be at the margins. We want to make sure that every individual life counts, that every individual has the opportunity to live and to grow and to thrive, and that we should invest in individuals not simply for what they can give to society, but because they are part of a society. The Holocaust was a consequence or a result of seeing people for what they contributed and how weakness of individuals may affect the strength of the whole. We need to see that our strength, that our community strength, is in how we protect people that we see as weak, or how we protect people who may be vulnerable, and not in how we dismiss them for the sake of our own strength.